Hi, I'm Anjali. I run the foundation that primarily works with cancer patients. We work both in the realm of cancer patients who cannot afford treatment, patients that come in across India, but mostly in the state of Karnataka, who can't afford treatment, and how do we help them? That's one of the activities that the foundation does. Another activity the foundation does is we have an art gallery, and the gallery works with, we work with artists who want to support our cause, and we do art shows where the funds go towards patients who cannot afford treatment. We also have a Pink Hope support group, which is for volunteers, and how we work with the volunteer program, both for patients that are undergoing treatment, whether they are women patients, elderly patients, or pediatric patients. And we also have activities, general fundraising activities throughout the year. And these kind of activities involve anywhere from a masquerade ball to a small art activity that can happen here twice a month. And we have musical mornings. And so when an intern joins and works with us, they get involved with the current activity that we're working for that month. Recently, we had an intern who worked with us on an art show that we had. We've had interns working with us on different various projects. And then the other realm of where an intern can be involved in is in the hospital sector, where they learn about oncology and they learn about how oncology treatment happens, both in the realm of India, but also how is it in the modern kind of the cutting edge technologies that we use in order to treat the patients. And we used various different models here on how we can help the patients who cannot afford, but also give them a high quality of care. So interns that come in can work with our quality department, where they work on indicators and they work on quality parameters. They also, interns work with our pediatric oncology units, where they learn about pediatric oncology, but they also have time to spend with the patients and kind of talk to the kids and talk to the various and what they're going through, so they see those kind of treatments. We also have interns that have worked with psycho-oncology, where they work with our psycho-oncology department and they work with the psyche of the patient. What is it the patient that is going through, and how are ways that we can overcome them? The foundation in general takes a lot of benefits from the interns, because both we like to learn what are the experiences that an intern has gone through and what they can bring to the table. Recently, we had a fantastic with some of our writings, where we get a story from a patient that can't afford treatment. We usually look at an intern to help us elaborate and to write up a good story that we can put on our website, or we can put in a film, so we can kind of show everyone what we're doing with the foundation and how we're helping these patients. So those are some of the things in a nutshell. But generally speaking, when it comes to the segment of health, especially in oncology care, we have so many different avenues for an intern to be involved, that it really looks at what the intern has had as the experience and what they look at as their expectation when they're coming in, because we kind of look at it as a mutually beneficial experience. The intern should have an experience that they are not able to have where they currently are, and we should have an experience where we're taking the strengths of the intern and utilizing it in some of the resources that we require, both in short-term projects as well as like long-term involvement in the foundation.